Thank you so much, sisters, just for being here, being in this incredible space. I also have the really great privilege of leading Cherished Futures for Black moms and babies. You know, so many of us who are on the line today, we have, you know, personal experiences and personal stories, or we know somebody who has experienced, you know, an infant loss or delivering, you know, a baby prematurely, having a very just traumatic birth or a near miss. You know, those experiences, those stories, they deserve to be shared and honored and recognized. But these experiences and our recommendations and our opinions rarely get shared outside of our spaces.
So today's Sister Circle is a much needed space, and it's important for us to have this intimate, collective conversation about how hospitals can better show up for us as Black mothers, our babies, and community. I want us to really enter into space through a libation that honors our ancestors and all those who have come before us and centers our womb for wellness.
I pour libation for the Black mothers that have left us all too soon. I pour libation for Marquita Johnson, who lost her life after conceiving her child. I pour libation for Khadijah West, who lost her son and her life. I pour libation. Ashe.
Ashe.
I pour libation for the grieving families of those that have died all too soon because of the cause of related pregnancy and childbirth.
Or what do we think that, you know, decision makers need to know about our experiences as Black women right now?
I am a birth worker. Black women need to be heard. And not only heard, they need to be respected. And not only respected, they need to be obliged. So anything that is coming out of a Black woman's mouth needs to be heard, needs to be taken action on, and needs to be believed. There's so much violence, and I see it in home births, and I see it in hospital settings, more in hospital settings than home births. But Black women need advocacy.
You know, recommendations are out there. So what's the accountability for these institutions to take them up and to make sure they're doing something with it and they're not just checking off the box, but they really are using them to guide practice transformation.
You know, when these things come up about implicit bias and racism, it's like, oh yeah, we're against that. We don't agree with that. But then you keep showing us on the other hand that in some form you do agree with that because you're not willing to change. You're not willing to go through what the process of change looks like. You know, for us, it's always either having to back off of being what some consider strong or boisterous or loud, when it's really just the fact that we're tired of having to talk to people about things that they should know. I mean, it's just simple, humane treatment, basic standards.
Okay, Black Lives Matter, and they want to put out their statement, say, all right, okay, here's a way, link your statement to some action.
You know, having some kind of ongoing representation, interaction between hospital leadership, folks on the front lines within a hospital system, and Black folks in a similar way as FQHCs require a client representative to be on their board of directors.
There's a disconnect between where we're sharing our lived experiences and our recommendations. That's not getting into certain spaces where we see more providers. There needs to be this opportunity for us to do the training ourselves, not just like some check the box.
We're treating them all the same. Well, Black women are dealing with a disproportionate amount of stress. We're dealing with a disproportionate amount of being locked out of access to so many things that help you to birth well. That's why Black women need a specific program. There has to be an acknowledgement of the unique harm that has been done to Black women.
If these hospitals serve the Hmong population, what are things that they would have to do and definitely would do in order to support that particular culture's community effectively? You know, they'd understand the history, they'd engage them in the work, they'd hire birth workers that are familiar with culture, various cultures and customs and dialects that the Hmong community have. They'd have ongoing dialogue. They'd have artifacts throughout the hospital that say, we care about you as a community. There'll be evidence of caring about and understanding. Pushback from hospitals on, oh, we treat everyone the same. It makes me think that they don't understand that though we each as Black folks have a unique experience, there's something shared and unique about our culture that is part of our shared experience in this country. And I feel like that they don't get that.
We building on our own something different that is for us, by us, so that we don't always have to rely on the system doing right by us. But we have to challenge them and fight them in the meantime, because every day we have women birthing in these systems.
I'm not a traditional doula, I'm a community doula, and those are two different animals. And if you don't understand that, then you don't understand what I do. And I may not do things the way that they're used to, but we are still doulas because our Black women are not the same as a white woman coming into the hospital.
Okay, a Black woman walks in the door, and every experience she has from the time she walks in the door needs to be attended to in a particular way, because otherwise her risk of loss of her own life or the loss of her child, or the risk there is enormous. So how do we alleviate that risk from the start? Not wait, or if they have pre-existing conditions. What can you do up front to isolate those cases? You have a team of birth workers, Black birth workers, who are assigned to your system, who are activated.
I feel you. It's like a reform. There needs to be a reform in the design and a reform in the policies and the decisions. They need to implement more training against implicit bias within the system. I feel like the more information that us as Black women share to the medical field, I feel like on one hand, they have the information. Now it's time for them to start doing the proper training to become more sensitive to our conditionings, and then also to normalizing trauma-informed care.
There is a lack of accessibility for Black birth workers to receive training on trauma-informed training, spitting babies. They're just not financially feasible for everyone. That most of, especially with the initiative now with frontline doulas, a lot of women just are not aware of the resources, and most of the people that are supporting Black women are not Black.
That would even mean, even creating the birth worker pool, midwives, doulas, OBGYNs, everything, creating an environment where we are actively doing pipeline programs, and all of those things are going to help to push people into this line of work so that we have competent healthcare workers to help us. And on all lines, whether or not you are licensed, we need to expand the pool of people who look like us.
But the reality is you have to have economic investment. It takes money to do those things. And so when I think about what can hospitals do, they can be making those type of investments into those things. Part of it is, we know that when people look like us and are serving us, especially in birthing, we just have better outcomes. I think the hospitals don't always necessarily trust that we know what's best for ourselves. They don't trust that Black birth workers know how to serve and know how to show up for their community.
That they should create a cycle where we know that when I tell my doctor or my provider in my hospital that X, Y, and Z is happening, that this is being reported, is going to get analyzed, and then thus provided the evidence base to make the changes necessary.
I just wanted to quickly recap a little bit about what I hear when we're talking about trust. So I think it's that we need more interaction, direct connection to care providers. We need space where you're actually coming in, you're listening to our stories, you're showing up. We see some level of accountability. And I would also add to that accountability and transparency.